So today we will discuss about the syphilis, which is very important regarding examination point of view. So basically, it is caused by a Treponema pallidum. Okay, so it is a sexually transmitted disease and a spirochetal bacterium disease caused by Treponema pallidum. Just remember this: it is a motile anaerobic bacterium. Right. So there are various modes of transmission. It may be sexually transmitted or maybe congenital. So according to that, it is acquired and congenital. Right. So congenitally, it is transferred from the fetus through the placenta or at the time of birth from the infected mother. If the mother is infected, it gets transferred to the child. Right. So there are various manifestations depending on the stages of the disease. So we'll discuss them one by one. First, primary, secondary, tertiary, latent, their signs and symptoms, and separately the congenital, which is early and late. We'll not discuss more of latent because it is not much important examination point of view. So first of all, we'll discuss about the primary syphilis. It is basically first stage after infection. So the important thing to remember in the primary syphilis is cankers, right? The cankers are the painless and localized ulcers with rolled edges. So the cankers present on the may be present on the penis of the male and uvula of the female. So most common site are cervix, vagina, uvula, anus, and mouth. So there are oral cankers also. They may be single, multiple, and may appear after 2 to 3 weeks after the contact. So in this case, there is enlargement of the regional lymph node, right? So just remember that primary syphilis has canker sores, right? So we'll just discuss about the brief of how the canker sores occur. The incubation period of around 9 to 90 days, usually 21 days. So just remember that you will get a range, you'll get direct 21 days, right? The four options may contain 20 days, 25 days, 35 days, and your 40 days. So just tick the 20, which is nearest to 21, right? So it developed at the site of contact, basically at the inoculation site, maybe single, multiple, painless, and with the rolled borders, raised borders. Okay, so most commonly, mostly anogenital, but may occur at the site in the oral cavity, the tongue, pharynx, lip, fingers, nipples, etc. Right. In the primary syphilis, I would like to discuss about the primary syphilis. The canker sores, when will not get treated or will not get any treatment from the doctor, then they may change after 6 weeks. After 6 weeks, change into secondary syphilis. So there are various things in the secondary syphilis. Just remember, in the primary syphilis, canker sores are there. So in the secondary syphilis, what happened in the secondary syphilis? Secondary syphilis is more of, you can say, the mucus patches, the skin rash, diffuse often with the superficial scale. So this is called papulosquamata. Superficial scale may leave residual pigmentation or depigmentation. So first of all, there is basically in the secondary syphilis, the mucus patches are there. So mucus patches, basically mucus patches are of red color, and they may be on the tongue, gingiva, right? And second, just remember this thing. Second is split papule. So split papule, basically there is erosion. There are cracks. So in around the angle of the mouth and nose, there are nodules. They may get eroded, right? Angle of mouth and nose. So they have nodules. They may get cracked, eroded. So these are eroded nodules. So this is called split papule, right? So the third one thing is condyloma lata, formed by the coalescence of large, pale, flat top papules occur in warm, moist areas such as perineum, and it is highly infectious. They are basically wart-like lesions. Wart-like lesions, right? So they maybe they are actually highly infectious, right? Then the mucosal lesions. 30% of secondary syphilis patients develop mucus patches, as I have discussed, slightly raised oval areas covered by grayish white membrane. You just not need to remember this. Just remember they are red in color with a pink base that does not bleed. Again, they are very, very highly infectious. Right. Now, they have one is they occurs after 6 weeks generally, right? So general signs are fever, malaise, general adenopathy, non-itchy maculopapular skin rashes, money spots. Involve the palm of the hands and the sole of the feet. Mucus patches and linear snail track ulcers are seen on the mucosal surface. The meaning of this is snail. These are snail track ulcers, lesions. What are these? The track which is left behind the track of the snail. They looks like that, right? So they are called snail track ulcers. And one thing, there are pigmentations, hyperpigmented macules on the body part. These are called lues maligna, right? These are higher pigmented spots, right? So the differential diagnosis for the secondary syphilis are tyriasis rosa, drug eruption, acute febrile exanthems, psoriasis, lichen planus, scabies, right? Then come to the tertiary syphilis. So tertiary syphilis, when the infection stage has reached into the advanced stage, that means they may get infect CVS CNS, and there is a formation of guma. So what are these? These are the swellings. These are the swellings present in the gums. These are the swellings present in the gums, right? And one more thing. So these are ulcerative nodules in the skin, bone, and the nervous system as a result of hypersensitivity reaction. So just remember this gummas. These are the swellings basically. That, so remember this, right? So this occurs after 1 to 10 years of previous infections, like first primary infection, then secondary, then your tertiary infection. Then come to your congenital syphilis. The mode of transmission, as I have already discussed with you, they get transferred through the placenta. So transplacental passage from the infected mother or from the mother at the birth time. So it is associated with several adverse outcomes, including low birth weight, premature body birth baby, congenital anomalies, miscarriage, or death of the baby. So in case of early congenital syphilis, there are skin lesions. These are called maculopapular tissues. Lymphadenopathy is there. Hepatosplenomegaly is there. Failure to thrive, jaundice, anemia, osteochondritis. And in case of late congenital syphilis, gummatous ulcer, bony prominence of forehead, saddle nose, short maxilla, keratitis, eighth nerve deafness, and dental deformities. So what are these dental deformities? So we have to discuss these dental deformities. I'll make a different video for that. But in case of dental deformities, there is a Hutchinson's triad. Hutchinson's triad. So in case of Hutchinson triad, there is a eighth nerve deafness, right? And interstitial keratitis. That means inflammation of eye. Then third one is a mulberry molars and notched incisors. So what are these? Mulberry molars are like cusps on the molars, right? And notches in the central incisor. So I'll make different video on the Hutchinson's triad because it is actually important. Then is your one important thing is ego Menaki sign. So Higo-Menaki sign is there. So Higo-Menaki sign is basically there is a thickening of irregular thickening of sternoclavicular joint. Sternoclavicular joint. There is irregular thickening of sternoclavicular joints, right? And ragged are also seen near the nose and the corner of the at the corner of the nose and corner of the mouth, right? Just remember sternoclavicular joint. Then come to the treatment portion, and one more thing you can see in the congenital syphilis, there may be parrot beak appearance, right? Treatment choice, the first treatment choice for all manifestations of syphilis is penicillin, right? Penicillin G is only therapy with the documented effect during pregnancy, right? During pregnancy time. Non-pregnant who have several allergic reaction to penicillin may be effectively treated with the oral tetracycline and doxycycline, right? Thank you so much.